Hello and welcome to vlog number 4. A few weeks ago I did a very stupid thing. I did what nobody with a mouthful of dental crown should do. I ate a toffee. Despite being very careful, i.e. trying not to chew it, I managed to dislodge one of my dental crowns from a molar. So I made an appointment to see my dentist and took along the offending crown, hoping that he would simply glue it back on. Unfortunately, the crown had come adrift along with a piece of my tooth, so that was a complete non-starter. My dentist decided that there was insufficient tooth remaining to simply recrown it, and told me that he would have to extract the broken tooth. Now, my dentist and I had already had a discussion about dental metals, how they can precipitate Parkinson's disease, which he was aware of and agreed with. The fact that I had had all of my dental metals removed because I believe that they did precipitate my Parkinson's disease. And we'd also discussed the fact that I had relatively recently had deep brain stimulation surgery, about which he was aware but did not have any in-depth knowledge. He asked me to contact the DBS team at the National Hospital for Neurology and Neurosurgery to check that they were happy for him to extract my tooth. Now I thought he was being overcautious. What possible objection could they have? Anyway, I did as I was asked and emailed the DBS team. I was surprised therefore to receive a letter by email from the team to be passed on to my dentist, containing a list of precautions to be taken and also contraindicated dental procedures. I have to be administered a precautionary broad-spectrum antibiotic an hour before dental surgery. This is to prevent the infection of my DBS system. I knew that infection of my DBS was an issue immediately following my operation. I was warned that if it became infected, then it was possible that my entire system would have to be removed. But I kind of assumed that the danger of infection passed once my wounds were healed. So it was a sobering thought that an infection from a dental procedure could infect my DBS system and perhaps end up with me having to have it removed. Hopefully the precautions are overkill and not based upon prior experiences. Diathermy, which is the use of electrical current in surgical procedures to cause clotting and prevent excessive bleeding, is contraindicated. Diagnostic ultrasound should not be directed on the cables or neurostimulator of my DBS system. If my dentist has to use electrocautery, then only bipolar electrocautery, whatever that is permitted. My neurostimulator must be switched off and the current path kept as far away from the neurostimulator and leads as possible. Any cables and leads should not be allowed to track across my neurostimulator implant. And dental drills and probes may cause electromagnetic interference on my DBS system. Understandably, my dentist was a little bit wary of extracting my tooth after reading this letter and ended up cancelling my appointment because he wasn't prepared to do it without first talking through the procedure with the DBS team. So, the upshot is that I spent the Christmas period with a broken molar, which thankfully was completely painless. Roll on 2017 when I can finally get it sorted. Right, that's enough from me. See you next year.